Hello, this is Brian Casey, Editor-in-Chief of AntMini.com, and we're here at the 2016 edition of the RSNA meeting in Chicago. We have with us right now Dr. David Levin of Thomas Jefferson University. Dr. Levin, thanks for being with us today.
My pleasure. Thank you.
Now, Dr. Levin has presented a number of studies at this week's RSNA meeting, but we're going to focus right now on a study that had some very interesting findings with respect to changes in the outpatient imaging world. Dr. Levin, can you talk to us a little bit about that study? Yes,
well, we took a look at outpatient imaging in the Medicare population. Obviously, an outpatient who needs an imaging study can have it done either in a private office or in a hospital outpatient facility. And we looked at every modality, MRI, CT, X-ray, ultrasound, whatever. And we found a kind of an interesting and perhaps somewhat disturbing phenomenon. And that is that in private offices, in virtually every modality, we saw that the utilization rate of imaging in those private offices is drifting downward over a period of years, the most recent years. In contrast, the utilization of imaging in hospital outpatient departments is going up. It's gradually going up. I mean, these aren't precipitous changes, but they're drifts, the downward drift in private offices and the upward drift in hospital outpatient facilities. So the question that this raises is there some problem in the future of private office imaging?
And what do you think is leading to these changes?
Well, that's a good question. I think the answer is clearly the reimbursement cuts. The reimbursement cuts have hurt private office imaging a lot. Because most of these cuts have been on the technical components side, and that's where imaging really gets hit hard in private offices. So whereas the effect of those reimbursement cuts on the technical side is really not felt that much by radiologists in hospital outpatient facilities, that's why it's kept up there. Whereas private office imaging is going down. The problem that this creates, of course, is that this leads to somewhat of a loss of access for patients who need outpatient imaging studies.
Because outpatient imaging centers are pretty convenient for patients. They don't have to go into a hospital. The outpatient centers tend to be located out in communities, and so it's pretty convenient for people.
It's definitely convenient. It's more attractive. It's they don't have to try to find parking spaces in hospitals. They don't have to be in a place that's crowded with sick patients and scheduled changes and emergency cases and things like that. So private office imaging is really extremely important, not only for patients but also for radiologists. So I think what radiology private offices need to do is they need to have certain strategies. One of the most important things that they can do right now, I think, is to develop a low-cost strategy to try to attract patients who are faced with high deductible health plans. We're now in an era where patients who need outpatient imaging are faced with $5,000, $6,000, even $7,000 deductibles before their insurance kicks in. So if they need an MRI or a CT and they haven't met that deductible, they're facing a real financial burden. So hospitals are notoriously rigid about how they deal with these high deductible health plans. They're very unwilling to change their charge master rates, which are usually extremely high. They just are not as nimble as you can be in private offices. So private offices, if they're smart, as I say, can adopt a more nimble strategy for dealing with the high deductible health plan patients. That's number one. Hospitals, as I say, just won't do that. It's a very complicated subject. We could discuss this for an hour. But hospitals just are not nimble enough to deal with this, and they're not willing to deal with it. Another thing that I think private offices can do is marketing. Marketing attracts outpatients. Hospitals are notoriously unwilling to market their radiology departments. I've never understood why they just don't get it, but they just don't get it. They don't want to spend the money to market outpatient imaging. Private offices do that, and they can do it to their own advantage. And then, of course, private offices, I think, have to be very patient-friendly, and it's easier for them to do that in an outpatient setting. So if private offices do those things, they deal with the high-deductible health plans, they do good marketing, they develop a very patient-friendly environment, I think they can do fine.
All right, great.
But there is some jeopardy there if they don't do those things.
All right, well, some great advice. Well, thanks for being with us today.
You bet, Brian. Good to talk to you.
All right, signing off for AntMini.com, this is Brian Casey.